So we're going to now turn to the physiology of the respiratory system. How does it accomplish those functions that we talked about earlier, such as gas exchange? And we do this through 4 processes. Pulmonary ventilation is breathing. So that's the act of inhaling or inspiring to take air into the body and expiring to remove air and gases from the body. External respiration is the diffusion of gases, primarily, not only, but primarily O2 and CO2, oxygen gas and carbon dioxide gas, between the alveoli of the lungs and the pulmonary capillaries. Transport of those gases is also part of this process, but we've actually talked about most of that when we talked about blood. The big piece we're going to add here is bicarbonate ion transfer of carbon dioxide. The bicarbonate buffer is exceptionally important in human bodies. It's the most important extracellular blood buffer, which means that it helps our blood resist massive swings in pH, because human bodies are very finicky. We don't like big shifts or big changes. Internal respiration is essentially very similar to external respiration, but here we're going to see the movement of gases from the body tissues, the cells of the tissues, to the systemic blood vessels. Now, before we can talk about how gases move and why they move, we need to look at some definitions, and you'll see those in red here. So we're actually going to start with intraalveolar or intrapulmonary pressure. This pressure is the pressure that's within, that's the intra, within the lung, within the alveoli specifically. And then intrapleural pressure is pressure that's in the pleural cavity. Now that should always be negative, and the reason for that is so that the lungs are continually forced to expand when we inhale. Otherwise, if that pressure becomes 0 or positive, you actually get compression, or what's called atelectasis, atelectasis, of the lung. That's a collapsed lung, which might happen through a bleb, through a spontaneous pneumothorax, or a traumatic pneumothorax, and you'll see that in a video I'm going to show you in a couple of minutes. Transpulmonary pressure is the mathematical difference between intraalveolar and intrapleural pressure, and we're not really going to worry too much about that one, other than to say that it should remain constant. So when we are inspiring or expiring, what our alveoli are trying to do is equalize internal air pressure and external air pressure. So Boyle's law is a critical law in understanding how and why gases move throughout the body. So I'm going to show you a video of that, and then we'll come back to inspiration and expiration.
In order to understand ventilation, we must first look at the relationship between pressure and volume. Pressure is caused by gas molecules striking the walls of a container. The pressure exerted by the gas molecules is related to the volume of the container. Let's see how volume affects pressure. This large sphere contains the same number of gas molecules as the original sphere. Notice that in this larger volume, the gas molecules strike the wall less frequently, thus exerting less pressure. Let's see what happens when it is decreased in size. In this small sphere, the gas molecules strike the wall more frequently, thus exerting more pressure. Notice that the number of gas molecules has not changed. These demonstrations illustrate Boyle's law, which states that the pressure of a gas is inversely proportional to the volume of its container. Thus, if you increase the volume of a container, the pressure will decrease, and if you decrease the volume of a container, the pressure will increase.
So there's a really simple example of Boyle's law that you may have experienced. If you left a soda bottle in a brand new unopened soda bottle in your car on a hot day, and then you went to open it, you would find that the soda explodes out of the bottle as soon as you open it. And part of the reason for that is because although the container size hasn't changed, the heat changes the gas pressure, so it increases the gas pressure, and then the gas, the carbon dioxide, wants to leave the bottle to help equalize pressure in the atmosphere and then in the bottle. So let's look at how we actually accomplish these changes in pressure and volume in the thoracic cavity. And we'll start with inspiration. So inspiration involves contraction of the intercostal muscles, the external intercostal muscles, and the diaphragm. So the diaphragm, when it contracts, does something that seems kind of odd. It actually, what we say, flattens out a little bit, but it goes from a very curved dome shape to a flatter curved shape. And because the intercostals pull the ribs superior and anterior, and then the diaphragm increases the volume of the thoracic cavity towards the bottom, the inferior portion, we have more volume in the thoracic cavity. The lungs will stretch because of that intrapulmonary pressure, and the pressure within the alveolus drops a little bit, goes to -1. So now air is going to flow into the alveoli to help equalize that pressure between the outside and the inside of the body. So inspiration is an active process. Expiration, on the other hand, is a passive process. You know, when people sigh and it feels kind of good to sigh, part of the reason for that is that you're relaxing those muscles. You're relaxing the intercostal muscles, you're relaxing the diaphragm. All of that is going to decrease the volume of the thoracic cavity and then force air out of the lungs. If you've ever kind of been like at the bottom of a pig pile or you go deep in a pool, you'll notice that the pressure from people on top of you or the pressure of the water pushing against you makes it a little harder to inhale because your muscles have to work harder to increase thoracic cavity volume. So I'm going to show you the rest of that video, and the rest of this video will show you those muscles of normal or quiet resting inspiration of expiration, and then it's going to go into the accessory muscles we use for harder breathing or more labored breathing, more strenuous breathing when you're, say, running from a big scary bear or you're exerting yourself, as well as some pathological conditions.
The volume of the thoracic cavity is changed by muscle contraction and relaxation. Take a few seconds to notice the movements of your chest during your own quiet breathing. During quiet inspiration, the diaphragm and the external intercostal muscles contract slightly, enlarging the thoracic cavity. Notice how the diaphragm flattens and moves inferiorly, while the external intercostal muscles elevate the rib cage and move the sternum anteriorly. These actions enlarge the thoracic cavity in all dimensions. As we learned from Boyle's law, increasing the volume decreases the pressure within the thoracic cavity and the lungs. Intrapleural pressure is the pressure within the pleural cavity. Intrapleural pressure is always negative, which acts like a suction to keep the lungs inflated. The negative intrapleural pressure is due to three main factors: the surface tension of alveolar fluid, the elasticity of the lungs, and the elasticity of the thoracic wall. Let's observe the effect of the surface tension. The surface tension of the alveolar fluid tends to pull each of the alveoli inward, and therefore pulls the entire lung inward. Surfactant reduces this force. Let's see the effect of the lung's elastic tissue. The abundant elastic tissue in the lungs tends to recoil and pull the lung inward. As the lung moves away from the thoracic wall, the cavity becomes slightly larger. The negative pressure this creates acts like a suction to keep the lungs inflated. Let's observe the effect of the thoracic wall's elasticity. The elastic thoracic wall tends to pull away from the lung, further enlarging the pleural cavity and creating this negative pressure. The surface tension of pleural fluid resists the actual separation of the lung and thoracic wall. Watch what happens if you cut through the thoracic wall into the pleural cavity. Air enters the pleural cavity as it moves from high pressure to low pressure. This is called a pneumothorax. Normally, there is a difference between the intrapleural and intrapulmonary pressures, which is called transpulmonary pressure. The transpulmonary pressure creates the suction to keep the lungs inflated. In this case, when there is no pressure difference, there is no suction and the lung collapses. Let's see why the other lung did not collapse.
Just an interesting note about pneumothorax is that in men from 20 to 40, and that's not the only range, that's just the general one, they can actually experience spontaneous pneumothorax, where this this lung will collapse and it pushes the aorta to the side, so that can be a fatal condition, and the spontaneous part is the scary part. Like, you're never quite sure when it's going to happen. More common in smokers, but not necessarily only in smokers.
Each surrounded by its own pleural cavity and pleural membranes. Therefore, changes in the intrapleural pressure of one lung do not affect the other lung. Several factors change airway resistance by affecting the diameter of the airways. They do this by contracting or relaxing the smooth muscle in the airway walls, especially the bronchioles. Let's see how these factors affect airflow. Parasympathetic neurons release the neurotransmitter acetylcholine, which constricts bronchioles. As you can see in the equation, increased airway resistance decreases airflow. Histamine, released during allergic reactions, constricts bronchioles. This increases airway resistance and decreases airflow, making it harder to breathe. Epinephrine, released by the adrenal medulla during exercise or stress, dilates bronchioles, thereby decreasing airway resistance. This greatly increases airflow, ensuring adequate gas exchange.
Although the video didn't actually show us forced inspiration and expiration, I was lucky enough to find some slides online. So forced inspiration, like taking a deep breath to blow out some birthday candles, or to yell to give your team inspiration, involves more muscles and hence more effort to increase the volume of the thoracic cavity more so. So here you'd be using the pec minor muscles, the pectoralis minor, a little bit of the serratus anterior muscle. Both of those are going to pull up on the ribs even more so. And the scalene muscle, that's a scalene group, there's 3 separate areas of that, and the sternocleidomastoid muscle, big ropey muscle that's in the neck. And those especially are used to pull up on the clavicle, the first rib, and the sternum. Forced expiration, on the other hand, involves the relaxation of the diaphragm and the external intercostal muscles, while also including contraction of the internal intercostal muscles, as well as the rectus abdominis, this straight muscle on the body wall, the six-pack muscle, somewhat the transversus abdominis, and definitely the external and internal oblique abdominal muscles. So a question to think about is, why is it better when you're doing like sit-ups or curls to breathe out? How does that help you build abdominal muscles even better?